Hi, I'm Nicole Sheahan, President of the Global Colon Cancer Association. We hope you're enjoying this intensive two-day educational course on biosimilars and biosimilar policy. As we've seen, there are a number of important biosimilar policy issues that are affecting patients worldwide across many different disease areas. We've learned about countries and regions where governments have enacted patient-friendly policies around biosimilars. For example, the substitution policies in most of Europe, where many biosimilars are available and bringing down costs. While biosimilars are encouraged, overall, patients and their physicians remain in control of their treatment decisions. This is due in part to there being very strong, well-organized patient advocacy communities and policymakers who worked collaboratively with them to develop these policies. European policymakers heard the concerns of patients and physicians, and for the most part, listened. And Europe now boasts the most robust, successful biosimilar markets in the world, with great savings and high physician and patient confidence. In other countries, however, like Canada and Australia, patient and physician concerns about forced substitution were too often disregarded or dismissed. The long-term sustainability of these biosimilar markets may even be in jeopardy as physician choices are restricted and fewer products are made available to patients. Patients and patient advocates in these countries have a much harder campaign ahead of them. It's always easier to stop a bad policy before it's been implemented. No matter which country you're in or what diseases you represent, to be an effective patient advocate on biosimilar issues, you need the knowledge, the training, and the tools. We've spent most of these 2 days hearing about the science, the issues, and the experiences of patient advocates. Right now, we're going to discuss the Biosimilars Patient Advocacy Toolkit. This toolkit will give you the tools that you need to get started in advocating on these important biosimilar issues for the patients that you represent. The toolkit can be accessed on the website learnbiosimilars.org. Maybe the most important feature in the toolkit is the key terms section. Biosimilar policy is complicated, and over the past 2 days, we've introduced many new words and ideas, and we know it's a lot to take in. The key terms section has simple, easy to understand definitions of these words and ideas, such as automatic substitution, interchangeability, and pharmacovigilance. We define these terms for you so that you can be sure to communicate accurately and clearly in all of your outreach to members and policymakers. We also don't expect you to memorize every single thing that you've learned here over the past 2 days. So we've archived all of these sessions so that you can rewatch them and recommend them to others in your organization or community. But to make things easier, we've created some straightforward fact sheets so that you can refer back to them. These contain the basics about what biosimilars are, how and why they're used, and what some of the policy concerns are around biosimilars. We encourage you to share these within your organization and community to get others up to speed. We also include a list of additional resources that you can consult for even more information. This includes links to patient education information from prominent regulators like the FDA, EMA, and Health Canada. It also contains links to resources provided by many of the speakers you've seen over the past 2 days. And these include patient education kits developed by patient advocacy organizations in Canada and Europe that dive deeper into biosimilar landscapes in those countries. We also link to survey data from physicians in 13 countries, gathered by the Alliance for Safe Biologic Medicines over the past decade, where physicians weigh in on these issues. We encourage you to check out these resources so that you can continue to deepen your knowledge about these issues and how they affect patients. Another feature of the toolkit is the questions to ask your doctor section. If a patient is being switched from one biologic to another, They may have questions, and this document is designed to help get the answers that they need. Maybe the switch is because of a medical reason, the physician wanting to try a different medicine, or maybe it's because of a new government policy or a non-medical switching, and that could be from a for-profit private insurer. For patients to remain in charge of their healthcare, it's important for us to know what's happening with our treatment and why. And this section was developed by experienced patient advocates with decades of experience, and it's been reviewed by physicians who themselves prescribe both biologics and biosimilars. One of the easiest things you can do with your newfound biosimilars knowledge and training is to create a position statement on these important issues. And we've included a few to get you started. You can take these position statements as is and put them on your organization's website. And they've been approved by the advocates and experts at Global Colon Cancer Association and the World Patients Alliance. Or you can use them as a starting point, and you can modify them to better fit your own organization's needs. Now that you're educated on the issues, it's time to start advocating on them. We've included a few sample letters to give you some ideas. These can be targeted at your national regulatory authority responsible for approving biologic medicines, or your health ministry, which manages health policies around biosimilars. Maybe your country is talking about allowing automatic substitution of biosimilars at the pharmacy. As we've seen in several countries, this is often the first step to mandatory forced substitutions. We've included a letter opposing this practice in the absence of studies that demonstrates that repeated switching can be done safely, and emphasizing the strong opposition to this practice among physicians and patients worldwide. We've also included some letter writing tips for you to consider, best practices that we've learned over the years in writing these types of letters to policymakers on a global scale. In our panel discussion, Lessons from the Patient Advocacy Experts, 4 of the most experienced patient advocates in the world reflect on their successes in biosimilar policy and elsewhere, and give their recommendations. We've summarized these recommendations and best practices into a document called 7 Lessons from Patient Advocacy Experts. This is a fantastic document for a patient advocate who's maybe just starting out or just beginning to get involved in biosimilar policy issues. These 7 lessons will give you, right now, the benefit of the collective wisdom gathered through decades of experience. This includes how to collaborate with allies, identify champions, make clear policy asks, build long-term relationships with policymakers, and stay informed and keep members engaged. This is one of the most important sections of the toolkit, and it will supercharge your patient advocacy abilities, not only in biosimilars, but any issues that you work on. So that's a preview of some of what's in the Biosimilars Patient Advocacy Toolkit. We encourage you to download it and save it alongside other policy resources. You can also print it out or share it with other patient advocates in your organization or community. You have the knowledge, and you've heard the success and horror stories. You know what's at stake. You've heard from leaders in the field, advocates who have been in this fight for years. And now it's an opportunity for you to be a leader in biosimilar policy. We're always here as a resource if you need help or have a question. Working together, we can ensure that biosimilar policy in whatever country you're in works for patients. Thanks so much.